Magic mushroom merupakan sejenis bahan psikoaktif baru atau NPS yang memberi kesan halusinasi yang cukup tinggi kepada pengguna selain tergolong dalam jenis dadah 3M iaitu bersama Molly dan McDonald. Berbeza dengan jenis dadah yang lain, akses terhadap Magic mushroom cukup luas dengan ia boleh didapati menerusi rokok elektronik yang dijual secara terbuka di pasaran. Menurut Ketua Penolong Pengarah Pemulihan dalam Komuniti, Bahagian Rawatan, Perubatan dan Pemulihan Agensi Anti Dadah Kebangsaan AADK, dadah jenis ini banyak digunakan dalam rokok elektronik.
Dia adalah daripada kumpulan dadah halusinogen. Di mana kesan dia boleh langsung macam memisahkan dunia realiti dengan dunia khayalan. So maksudnya once dia ambil magic mushroom ni, kenapa kita nak highlight perkara ni? Because of dia sekarang banyak digunakan di dalam cecair-cecair vape.
Menurutnya, dadah jenis ini tidak dapat dikesan menerusi ujian air kencing, namun memberikan kesan luar jangka yang berpotensi menyebabkan kecederaan kepada pengguna dan orang sekeliling.
Ada seorang ibu tu call, saya ingat lagi, dia call, dia bagi tahu anak dia balik daripada sekolah, panjat dinding. Cuba menghantukkan kepala dia ke dinding. Kita tanya dia buat apa? Dia baru hisap vape je. So kita tak boleh check dalam dia punya urine.
Tambahnya, kesan dadah jenis Magic mushroom adalah lebih parah berbanding dadah sedia ada, sehingga usaha yang sangat tinggi diperlukan bagi mencegah penularannya di negara ini.
Pada akibat isap vape, seorang pelajar lelaki tingkatan 4 dari Kemaman, Terengganu ditemui dalam keadaan tidak sedarkan diri di perkarangan sekolahnya, dipercayai akibat menghisap vape jenis Magic mushroom secara berlebihan pada Isnin lalu. Menurut sumber, pelajar lelaki itu terpaksa mendapatkan rawatan perubatan setelah mengalami kesan teruk akibat dari pengambilan bahan kimia itu. Pelajar itu kemudiannya telah dirujuk ke unit kecemasan Hospital Kemaman. Difahamkan mangsa telah mengalami sawan kritikal berpunca dari pengambilan perisa bahan kimia yang berbahaya itu secara berlebihan dan sehingga kini pelajar berkenaan dilaporkan masih dirawat dalam hospital.
Dulu 5 hari, lalu dah sehari boleh dapat dah. Jangan buat ada orang, saya temu malu. Relax. Jom, saya ada macam
ni vape ya?
Vape tu, dia bubuk flavor dalam flavor tu, nama dia mushroom. Nama cendawan elok, tapi kena ada dia ni.
Aku meskin apa?
Owner Syak Mushroom Syak Mushroom. Langgar kereta sebelah. Kereta dah tahu.
Students currently vapes in the US, and in the UK 7% of kids aged 11 to 17 now vape. And that number has nearly doubled in the last 2 years, so currently more young people vape than smoke cigarettes. But with the news of vape deaths amongst young people, the insane chemical flavoring and lack of regulation amongst new vapes, could science now say that vaping is worse than cigarettes? To start, the nicotine in vapes hits your bloodstream and brain faster than cigarettes. This is because vapes consist of a coil that ranges from 110 degrees Celsius to 1,000 degrees Celsius, which creates thermal conditions for a carrier like propylene glycol, which is literally stage smoke. Yes, when you are vaping, you're inhaling like Taylor Swift stage smoke right into your lungs. Mixed with an active ingredient, most commonly nicotine, and chemical flavorings, the vape smoke hits your lungs in a way that studies show ushers nicotine faster into your bloodstream and brain than cigarettes. Another study found that the sheer way that people like hit vapes like so hard, bro, each puff gives you more nicotine in vapes than in cigarettes. And nicotine is an intense drug. I always say that the hardest drug I did this year at Pride was when I hit someone's vape at a rave and I was ripped. This is because when you vape, the nicotine enters your bloodstream through the lungs, where it quickly makes its way to your head and passes through the blood-brain barrier to go directly into your brain. Here, the nicotine causes a series of complex biochemical processes to increase dopamine, cause feelings of motivation, awareness, concentration, elevated mood, and other neurochemical processes that will relax your muscles. Nicotine's an interesting drug. It makes you feel mentally aware and alert while physically relaxing you. It's an amazing feeling that people get addicted to. As the nicotine rush ends, cravings begin, and most recent studies show that the cravings appear within 4 hours of your last nicotine hit. In theory, this whole process is more intense with vapes than cigarettes because vapes have more nicotine in them. Nicotine also alters blood flow in your body, making people with penises lose their penis girth. Yep, a bit of watermelon ice can shrink your dick. One study found that men who use e-cigarettes are more than twice as likely to experience erectile dysfunction compared to those who don't vape. 13,000 men aged 20 and older who had daily e-cigarette use were 2.2 times more likely to report having erectile dysfunction compared to men who had never vaped, regardless of other risk factors. Because ED is caused by nicotine and there's more nicotine in vaping than cigarettes, in theory, you will get more erectile dysfunction from vaping. Now, you also may have heard of the mysterious vaping deaths that as of February 2020 had 2,807 patients hospitalized with severe lung issues from vaping, some of who were under 18 years old, and 68 people ended up dying. What you may not have heard is that these deaths were actually from THC vapes, which are less regulated than nicotine vapes. Some of the THC vapes had a chemical called vitamin E acetate in them, which when inhaled ravaged people's lungs and alveoli, leaving them with symptoms of coughing, wheezing, and chest pain. Doctors were shocked and scared at first, but the general consensus was that mistakenly there was vitamin E acetate ending up in THC vapes, which was killing people. It created a disease called e-cigarette or vaping use associated lung injury, aka E-Valley. Now the hope is that there obviously isn't vitamin E acetate in THC vapes anymore, but again, E-Valley, the disease, was never caused by nicotine vapes. But that doesn't mean there isn't other wild chemicals in these vapes because of the flavoring. The concept of vaping was designed to be tasteless and ugly as a mechanism to help people quit cigarettes. But capitalism came a-calling, and to expand the vaping market, companies started adding flavorings to make people want to consume vapes more. Cinnamaldehyde, the artificial flavoring that creates cinnamon flavor in food, is now added to vapes to give them a cinnamony taste. But cinnamaldehyde also has been found to make the cilia in your lungs stop working, making it harder for your lungs to get rid of debris and expel pathogens, leaving you more vulnerable to lung infection. 2,5-dimethylpyrazine is added to vapes to make them chocolatey, and isoamyl acetate is added to create a banana taste. These chemicals have been found to cause pro-inflammatory effects on the respiratory tract that lead to cancer. A recent study found vape smoke contains benzene and other volatile organic compounds which lead to chronic respiratory conditions. Also, the vaping coils have manganese and zinc in them, which you end up inhaling, and this causes airway epithelial injury and tissue hypoxia. Mice chronically exposed to vape aerosols developed lung changes consistent to chronic obstructive pulmonary disease, aka COPD, the disease that kills 100,000 Americans a year from smoking. But in the end, scientists and physicians agree that cigarettes are still worse than vapes. Cigarettes involve a combustion reaction with tobacco that causes you to inhale tar and other chemicals that ravage the lungs in unbelievable ways. One lung researcher compared smoking cigarettes to putting your mouth over a car exhaust pipe and inhaling. Also, you may not know this, but 1.3 billion people in the world currently smoke cigarettes. 1 in 8 people is a smoker. This is why cigarettes are killing millions of people a year. Cigarettes are a worldwide trend, whereas right now vaping is mostly relegated to Europe, the US, and
Hai semua, saya Dr. Hidayah, host anda untuk Smile 4.0. Kali ini kami membawakan 4 sesi webinar dan 1 sesi podcast bermula dari 19 Mei hingga ke 22 Mei. Mari sama-sama kita mengupas dengan lebih mendalam isu vape daripada pelbagai sudut. Jom kita dapatkan informasi lebih lanjut.
Assalamualaikum dan salam sejahtera. Vape memang nampak cool. Tapi tahukah anda terdapat bahaya yang tersembunyi dalam vape yang dapat memudaratkan kesihatan? Ayo, sertai saya, Dr. Adib, di siri webinar Smile 4.0 bertajuk Mengatasi Ketagihan Vape, Bahaya Tersembunyi. Langkah berhenti dan kekal bebas vape pada 19 Mei 2025 jam 9 pagi. Bersama pakar dari Universiti Tanah Air, kita mengupas dengan lebih mendalam isu ini.
Pernahkah anda terfikir apakah implikasi industri vape ke atas sistem kesihatan negara kita? Temui saya Dr. Nurani Dahani bersama pakar-pakar khas yang telah dijemput bagi membincangkan isu-isu ini melalui siri webinar Smile 4.0 dengan tajuk From E-Cigarettes to Healthcare, Exploring the Financial Implication of Vaping Industry pada tarikh 20 Mei 2025 jam 2.30 petang. Ayuh, jangan lepaskan peluang keemasan ini.
Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Jom sertai saya Dr. Nurin dalam sesi webinar Smile 4.0 yang bertajuk Pendekatan Menangani Isu Ketagihan Vape pada 21 Mei 9 pagi. Dalam sesi webinar ini, kita akan membincangkan bagaimana sistem sokongan dapat membantu remaja yang terjebak dengan vape, peranan guru dan peranan tugas kesihatan. Jadi, jangan lupa sertai kami ya.
Assalamualaikum dan salam sejahtera. Saya Dr. Julia ingin menjemput anda semua ke webinar Smile 4.0 yang bertajuk Vape and E-Cigarette Under the New Law pada 22 Mei 2025. Di dalam sesi webinar ini, kita akan memberikan penerangan jelas mengenai Akta Kawalan Produk Merokok demi Kesihatan Awam iaitu Akta 852 yang telah dikuatkuasakan pada 1 Oktober 2024 yang lalu. Selain itu, kita juga akan mendapatkan pandangan pakar-pakar mengenai pelaksanaan akta ini di negara ini. Ayo sama-sama kita fahami dan sebarkan maklumat ini.
Hello, hi. Betulkah vape lebih selamat dari rokok konvensional? Adakah ini mitos atau fakta? Anda semua mesti nak tahu kan? Jom sertai saya Dr. Nurain dengan tetamu jemputan khas di seksi podcast yang bertajuk Vape vs Rokok, Mitos dan Fakta Meneroka Trend pada 21 Mei 2025 jam 8.30 malam. See you there!
Jangan lupa sertai sesi webinar Smile 4.0 yang bermula daripada 19 Mei hingga 22 Mei. Maklumat lebih lanjut boleh didapati di www.smileytm.com. Jangan lupa juga follow kami di social media Facebook, Instagram dan juga TikTok. Akhir kata, keep the habit, drop the vape and live more. Jumpa anda di sana.
Assalamualaikum warahmatullahi wabarakatuh. Greetings and a very good afternoon, ladies and gentlemen. Welcome to Smile 4.0 webinar series, proudly brought to you by the Faculty of Dentistry UITM and streamed live via the Smile UITM YouTube channel. We are thrilled to have you join us today for this exciting continuation of the Smile 4.0 webinars. This webinar is a part of the SMILE 4.0 program, which aims to raise awareness and share up-to-date information on the growing concern surrounding vaping and electronic cigarettes, particularly among high-risk groups. SMILE is an acronym for Selamat, Masyarakat, Ideal, Lancar, and Equity, representing our aspiration to deliver dental and oral health services that are safe for the community, operate smoothly and efficiently at optimal capacity, and uphold the principle of equitable access to health services for all. SMILE 4.0 is proudly held in strategic collaboration with the Malaysian Association of Dental Public Health Specialists and the Malaysian Dental Association. The program is also supported and sponsored by the International College of Dentists. The theme for the year's program is Kick the Habit, Drop the Vape, Live More. Is a powerful message encouraging individuals to break free from nicotine addiction and embrace a healthier, more meaningful life. It is our hope that this program will serve as a valuable platform for intellectual discourse among the dental community and a reliable channel for disseminating important health information to professionals and the public alike in our shared goal of achieving ideal, high-quality oral healthcare services in line with contemporary challenges. Ladies and gentlemen, a quick recap from yesterday's session. We delve into the important topic, mengatasi ketagihan vape dan rokok elektronik, bahaya tersembunyi, langkah berhenti dan kekal bebas vape dan rokok elektronik. It was an eye-opening discussion focusing on the hidden dangers of electronic nicotine delivery systems and practical steps toward quitting and staying vape-free. The session was also held in parallel with the official launch ceremony of the SMILE 4.0 webinar and podcast series. The ceremony was officiated by the Honorable Dato Lukanisman bin Awang Sauni, Deputy Minister of Health Malaysia. Ladies and gentlemen, this afternoon, in the second session of the SMILE 4.0 webinar series, we will be exploring the topic from e-cigarettes to healthcare, exploring the financial implications of the vaping industry, and we have a great lineup for you. Our moderator for today's session is Dr. Nurani Dahani Ruslan, and joining us as panelists are Professor Emeritus Dato Dr. Syed Mohamed Aljunid, Professor of Community Medicine from International Medical University IMU, and Mr. Azrul Mohd Khalid, Head and Founder of the Galen Centre of Health and Social Policy, who will be sharing their insights and experiences on this important topic. Without further ado, I now invite our moderator to begin the session. Over to you, Dr. Nurani Dahani.
Thank you, Miss MC of the day, Dr. Nur Ain. Assalamualaikum and a very good day, everyone. Welcome to the SMILE 4.0 webinar series hosted by the Faculty of Dentistry, University Technology Mara. This year, we focus on vaping-related public health issues with theme, Kick the Habit, Drop Vape, Live More. Thank you for joining us. So, today's webinar is titled, From E-Cigarettes to Healthcare, Exploring the Financial Implications of the Vaping Industry. I'm Nuranida, will be your moderator for today's session. We are truly honored to welcome two distinguished panelists who will be sharing their expert perspectives on this topic. This marks the second time these esteemed experts are coming together for SMILE program, where their first collaboration took place in a previous edition, SMILE 3.0. And their session actually received an overwhelming positive response. We are deeply grateful for their presence once again, and thank you both so much for joining us. It is a privilege to have the very best with us today. So now allow me to introduce our panelists for today. We are deeply honored to welcome our first panelist, Professor Emeritus Dato Dr. Syed Mohamed Aljunid, a distinguished expert in health economics and public health. He currently holds the position as the Public Health Medicine Consultant and Professor of Health Economics, Policy and Management in Faculty of Medicine, University Kebangsaan Malaysia. He also serves as a Professor of Community Medicine in the Department of Public Health and Community Medicine, IMU. He has advised leading international organizations such as the World Health Organization, World Bank, and Ministry of Health Malaysia. With more than 300 scientific publications and recognition as one of the top 2% most cited scientists globally by Stanford University in 2024, Professor Aljunid continues to be a driving force in shaping health policy, be it locally and internationally. So how are you today, Prof. Dato?
Alhamdulillah, thanks for Dr. Nurenda for inviting me to share my views in this session. It's very important and very interesting session that you have organized. Yeah.
Thank you so much, Prof. Dato. Next, we are pleased to introduce our second panelist, Mr. Azrul Mohd Khalid, Founder and Chief Executive Officer of the Galen Centre for Health and Social Policy. A prominent voice in public health advocacy and policy reform, he has worked with various international organizations, including the Joint United Nations Programme on HIV/AIDS, UNAIDS, the United Nations Children's Fund, UNICEF, and the Malaysian AIDS Council. He is also the co-founder of Code Blue Health News and a board member of the Centre to Combat Corruption and Chronism C4 Centre. Mr. Azrul is also a regular commentator on health policy, including as a co-presenter on the BFM 89.9's Health and Living program. So, Mr. Azrul, nice to see you today.
Thank you for having me, Dr. Nurenda.
Thank you, Mr. Azrul. So for your information, this session will run approximately for an hour and 20 minutes, followed by a short Q&A session around 15 minutes, where you may submit your questions through the chat box. Now, without further ado, let us begin today's discussion. For round one will be vaping and public health landscape. So to start us off, recent data taken from the National Health Morbidity Survey, Adolescent Health Survey in 2022 shows that e-cigarette use among Malaysian adolescents aged 13 to 17 has increased from 9.8% in 2017 up to 14.9% in 2022. And these days, e-cigarettes are widely promoted through social media and vast marketings that often featuring celebrities and influencers. And because of this aggressive marketing, the number of people who vape is likely continuing to rise. So the first question for this round will be directed to Mr. Azrul. So Mr. Azrul, from your point of view, how do you think has vaping reshaped tobacco and nicotine consumption pattern in these recent years?
Thanks, Dr. Nurenda, for this opportunity to comment on this very important issue. When we look at how vape and specifically nicotine vape has, as you can mention just now, reshaped the landscape concerning nicotine tobacco use, it is quite a dramatic change when we consider how e-cigarettes is relatively recent innovation over the past 20 years, where before that we didn't have it, and when it did come into the market more than 10, 15 years ago, it has dramatically changed the way that nicotine addiction is actually dealt with here in Malaysia. And vape, really, when you look at it, has been something of a alternative, really, as a nicotine delivery device. When you consider the fact that all this while you have combustible nicotine in the form of cigarettes, cigars, even the heat not burn type, you now have a situation where you can have in liquid form nicotine that is heated up and then the fumes to be then inhaled. And this is something that, when you consider the fact that it is being promoted in a very different way compared to cigarettes, what we're actually seeing now is there being a parallel industry, parallel market of both people who smoke combustible tobacco, cigarettes, cigars, etc. That's rolled cigarettes and so forth. And then also along that, you have vape and e-cigarettes for which there are nicotine and non-nicotine. So you now have two parallel pathways for which a person could be addicted to nicotine, for which in the past there was very much only one. So this has resulted in a whole new industry, a whole new economy, I would argue. And certainly the consumers that are using this is very much something that in the past, our objective has always been to reduce the number of smokers, to reduce prevalence of smoking, and that's been always a target for which Malaysia uh, has been relatively successful, but has stagnated over the past several years at around 21%. What is alarming is that on one hand, you have stagnated the prevalence for cigarette consumption, cigarette use, and then on the other side, you have an increase in prevalence for those who are taking up vape and e-cigarettes. And this is where it gets very, very worrying because you see trends that we haven't really seen in the cigarette industry for over 40, 50 years. You see things that were banned in cigarettes emerging from vape and e-cigarettes, targeting young people, adolescents, the kind of imagery, the kind of marketing, branding that is meant to look hip and cool, all of which was all banned under the cigarette smoking, now being replicated in the vape side, for which we are able to suddenly see the same tactics that we've been using for cigarettes in the 60s and 70s now coming up for the use of vape. So what we're seeing is that there are more and more people taking up vape as a nicotine delivery mechanism. And here's the thing, yeah, Dr. Nanida, if there's anything that we can take away from in terms of how serious this issue is, consider the fact that 15 years ago it was non-existent really in terms of the prevalence of people taking up vape. It was really, really small, the numbers. Today, when we look at the number of people who are taking up vape compared to cigarettes. So cigarettes, if you look, it's at around 21% of the population, and almost half of all adult males are smokers. And for women, it's around 1.1%. When you compare against the industry data, which they've done surveys to look at where the prevalence is in terms of those who are vaping, and herein that you can see that, remember, amongst the general population, it was around 21%, for which almost half of men smoke and 1.1% are female. When you look at vape, you find that the prevalence now is around 30%, out of which, and this is looking at the findings from the industry-led study, 68% are males and 30% are female. So think about it. You almost eliminated smoking amongst women with 1.1%, yet amongst women who vape, the numbers are not decreasing, they're increasing. So we're seeing a staggering increase in the number of people who are newly taking up nicotine vape who have never smoked before. Yeah, so these are new users. They have never smoked before. They're not transitioning from cigarette smoking to vape. They have never smoked before, and they're newly taking up nicotine through vape and e-cigarette. So I think maybe we'll start there first, considering how the landscape has changed and how it's becoming more and more severe, really, and more alarming, really, because the number of people is alarming, but also how young those who are newly taking up nicotine vape is also the age is dropping to the point that we have cases where a 10 or 11-year-old have been reported to be vaping 5% nicotine e-cigarettes. So this is quite worrying and something to bear in mind in our discussion. Over to you.
Okay, thank you, Mr. Azrul. Just like Mr. Azrul has said, we didn't even have vape in the last 15 to 20 years ago. And nowadays, we have observed a very dramatic increase in numbers of people who have vape due to various type of e-cigarettes that are available in the market. And also, we have seen a tremendous increase in numbers of people who have vape, especially females, and also the youngsters that have taken vape at such an early age. So, bringing the floor to Professor Dato, now Prof. Dato, from a public health perspective, how has the rise of vaping in Malaysia influenced health outcomes so far? Do you think that we have seen more positive developments, or do you think that we have new challenges emerged?
Yeah. Thanks again, Dr. Nuranida. If you look at from the public health perspective, we were fighting against cigarette with the introduction of FCTC in the early 2000s. And there was a lot of gains in terms of the control through the mechanism where government have put forward to control the smoking. However, we were very unlucky because in 2003, they introduced the vape, and it has taken a different sort of situation where we are facing with huge challenges now on how to control this. I think if you look at the Global Adult Tobacco Survey 2023, it shows that the rate of increase of vape among adult is nearly about 600%. And among the 15 to 24, it's about 8.6%. This is from the GAT survey 2023. From our survey, it is higher than that. And I think Mr. Azrul has mentioned also from the industry, the figures is staggering. So from the public health perspective, we have been working on the impact of cigarette on public health, the impact of the rise in the chronic non-communicable diseases due to cigarette. But now we are facing a different challenge. So still there are a lot of issues on information regarding the health impact of cigarette, of the e-cigarette or vape. It is still, we are still collecting this information, and I think many countries are still struggling to see what is the short-term and the long-term impact. We know about EVALI, but then there are other things that we do not know about the long-term impact of vape, especially on chronic non-communicable diseases. If you look at cigarette itself, studies have shown that cigarettes contribute nearly about 60 to 70% of the resources that we use to manage chronic non-communicable diseases. And I'm sure with vape, a lot more resources will be spent in order to manage this. And EVALI is only one of the scenario, but we have so many other conditions that might be related to the nicotine use, and also all the substances that they have added to the vape liquid that which is not properly controlled. I think really it creates a lot of stress on public health in managing this issue, and we have to find a solution to this through multiple sort of actions from the policy side, from the enforcement, and also from health education aspect. So I think at the moment there are too many challenges that we are facing, and I think this is a big issue that Malaysia and also other countries have to face with.
Okay, thank you, Prof. Dato. So now it can be concluded that we are facing different challenges due to the changing pattern of nicotine use. Before this, people are more towards conventional cigarettes, but nowadays we are discussing about vaping, which is we still have very limited data available nowadays in terms of the health implication. So building on that, we will now move to round 2 of the discussion, which is the financial and economic impact. So for this round two, the first question will be directed to Mr. Azrul. From an economic perspective, Mr. Azrul, how is the vaping industry currently positioned in Malaysia? And which sectors do you think, or any stakeholders, that appear to benefit the most from this vaping industry growth?
Well, Doctor, this is one of the more difficult issues, really, for us to address. And this goes back to the fact that the vape economy is very much embedded within the Malaysian economy. And a lot of people don't know, but Malaysia is actually one of the biggest, if not the largest exporter of vape liquids in the world to other countries. Other countries import Malaysian Malaysian vape liquids for the use of their vape devices in other countries like in the US and the UK and so forth. So China is also quite big, but Malaysia is also just as big and is a major player here. And this is very important because when you look at vape, there are actually at least two types of vape. One is open systems and closed systems. So, if you look at closed systems, these are systems which are very commonly in the form of disposables or pods, where you can just, get the different pods and put it into devices, and then you have different flavors and so forth, and then you'll be able to then use them and then discard them. And very often these are, as mentioned just now, they're closed systems. They're manufactured at the factory, and then they are sold as pods and disposables and so forth. The open one, which is where a lot of the business can possibly come from, and for which Malaysia is a very big player in, is that the liquids can then be added on, mixed up. There's concoctions, different flavors, unique combinations. That's where you get the teh tarik, you get the air bandung, and then you've got a little bit of a cake because you add on some nicotine in there. And the problem here is that when you look at it, this is a huge area for which the vape economy, for Malaysia at least, has been a leader in. So when you look at how that translates to the economy, and again, we look at some of the data that comes out from the industry, the vape business now has actually grown significantly. And this has very much exploded over the past 10 years or so, to the point that, when you compare with back in 2019, the value of the vape industry is around 2.3 billion ringgit, and today it's closer to around 4 billion. And this marks a huge increase, around 53%. When the study that was conducted in 2023 was put together, it found that there were general retail stores selling vape. Around 7,500 shops were selling vape on their racks. But after the government deregulated liquid nicotine under the poisons schedule a couple of years ago, under the previous health minister, Dr. Zaliha, there was an explosion of new shops selling vape. So the point that basically you could get it anywhere, even the chain shops, the 7-Elevens, the mynews.com, many of the retail chain shops that didn't sell vape before, because it was legal to do so, they started selling. So this number that we are referring to back in 2023 has now exploded to possibly around 60 or 70,000 shops that are currently selling vape, and that's not including some of the smaller retail outlets, because at that point of time, before the passage of the recent piece of legislation, there was no regulation at all for us to regulate vape. So the economy itself grew. It was legal at that point of time to even sell vape to children, and children could legally buy vape as well. So there was a huge opportunity for for that. So when we look at the data, we only look back to that 2023 data, but even then it was quite high already in terms of the number of shops that were selling. And you also look at it not just in terms of the business perspective, you also look at how many people they employed. The vape industry at 2023 actually employed around 35,000 people. And as a result, contributed a significant amount to the GDP of the country. I think around 1.2% could, in terms of the general contribution of the industry itself. So we find that with the employment factor, with the fact that it is able to pay taxes, it's able to grow a new industry, it's a major contributor to the economy. But one major issue is also something that is very problematic for us to address, and that's the issue of the Bumiputra ownership of the vape industry. And this is very important because the majority of businesses in Malaysia that own the vape industry are Bumiputra. And so it presents a political problem when you are looking at this issue. Because it is a source of revenue, it's a source of taxes, it's also a place for employment, but also entrepreneurship. And it is going to be a major issue to consider if we are going to think about bans, for example, if we want to talk about restrictions, new laws and curtailing. So a politician would be very hard to look at this issue of the economics of vape, seeing how it's positioned within the context of the political conversations that occur, and trying to decide on whether or not to ban vape or businesses that are involved in the vape industry. So I think that puts it to a certain extent how the economic perspective of the vape industry. But I can say to you very clearly that because a lot of these businesses that are involved in vape are also small businesses, that in itself is a problem, because it could also be seen that cracking down on these businesses is like cracking down on small businesses. And there is a situation of victimizing small businesses out of their ability to earn a livelihood. So we haven't even spoken about the enforcement challenges that come out from doing something like this. But
Maybe we could see that enforcement later.
later, yeah.
Mr. Azrul,
But
because
later, what we need to really consider is the challenges when we are dealing with enforcement. All these factors come into play. Very important, which is why I wanted to mention that before we go into enforcement later on. So I hand it back to you, Dr. Noy.
Okay, thank you, Mr. Azrul. So you have mentioned just now about the increasing numbers of vape retailers. So now let's talk about restrictions and regulations. So in your opinion, Mr. Azrul, do you think that the current regulatory environment considered as sufficient in order to manage the mushrooming of these vape retail outlets across Malaysia? And what do you think might be the economic implications if the growth of these unlicensed, or what we call informal vape retailers, continues without any adequate regulations?
Well, I'm sure Prof. Syed has a lot to say on this topic later on in his intervention, especially concerning the health economics part of this, But I can tell you that the current regulatory environment is still a little bit uncertain. Simply because we are coming off from the back of a year and few months of total unregulated, entry for vape, and especially nicotine vape. So besides the point that I mentioned just now, how we are able to sell nicotine vape to children previously, it's also very important to understand that the concentration of nicotine vape in our liquids here are some of the highest in the world. If you go to other countries, like you go to New Zealand, Australia, you go to UK, or places where vape is regulated, you cannot get the type of concentrations that you can get in Malaysia from 7-Eleven or mynews.com or Family Mart at 5%, or at a vape shop. You can only get maybe at the maximum 3% if you're lucky. 2% is generally the case. High concentrations are reserved for what is considered prescription only formulation. So therein lies the issue of looking at regulations here and seeing how, even on the issue of nicotine concentration regulation, are we going to be able to enforce that? Now, to be fair, the part of the regulation that is going to come into force concerning concentration only comes into force on the 1st of October. Yeah. So we'll see what happens then. But right now, from the 1st of April, what was supposed to come into effect was the issue, and this is regulatory environment, yeah, was the issue of a display ban that was supposed to come into effect. So under the new regulations, under the new law that came into effect after it was gazetted and now we are supposed to be implementing, is that you're supposed to now have a cover, yeah? You cannot openly display tobacco, cigarettes, cigars, vape, e-cigarettes, heat not burn stuff, whatever. You cannot have it displayed. So if you go in other countries, you'll find that there's a plastic sheet, covering the display. So if you want to get something, you have to reach behind the display, the curtain, and take out the item. So you cannot see it straight up. In Malaysia, we've approved regulations that are supposed to enforce that display ban, meaning you're supposed to not be able to do that anymore. And vape, e-cigarettes are treated like cigarettes as well. So no advertising, no marketing, no etc. But today, if you go to these retail shops, you can still see it open there.
Yes.
You can still see. Go to any shop right now, a chain shop, retail shop. You can see cigarettes, e-cigarettes openly displayed, despite the fact that there is a display ban in effect right now. And one of the reasons why is because the industry have somehow negotiated for another 6 months to get more time to prepare. I don't know how much it costs to buy a sheet of plastic from EconSave or Justco or DIY, Mr. DIY, and they cut out the plastic and put it over your display. But they said they need another 6 months to implement that display ban, and so Ministry of Health said, okay, you get another 6 months. So in October, baru we'll see whether or not that display ban is going to be in effect properly. But they might come up with another excuse. So the problem here is the regulatory environment itself has to be strict. Now, I'm very concerned at the fact that very often enforcement falls onto Ministry of Health to enforce. Now, how many inspector kesihatan do you have lah at the end of the day? These are the same guys who are inspecting restaurants, kedai mamak, going into cases of food poisoning and food safety, and these are the same guys that you're expecting to go and segah, some of these retail shops to see whether or not they are displaying or selling or regulating vape and so forth. It is a huge endeavor, huge challenge, and this is something that we, looking at it now, when you consider the fact that the market, which we mentioned earlier, is growing. There are more users today. There are more people who are vaping. There are more people who are disregarding the no vaping, no cigarette smoking signs. There's a lot of people to issue summons,
Yes.
but also we don't have enough people to enforce the regulations. And therein lies the problem. Is it only good on paper, but in actual real life, it's not going to be seen as something that is reasonable or realistic to enforce. So to do that, we have to look at other countries, how they're enforcing their regulations, how they're putting it together. And what we really see, in my opinion, is a change in attitude and behavior concerning cigarettes in the past that may need to be adopted for vape and e-cigarettes, where attitude and behavior is the tricky one, Dr. Nanida. I have to say to you, there is a reason why young people are vaping and using e-cigarettes a lot more compared to older people, and one of the reasons why is vaping and smoking vape and e-cigarettes looks cool. Comes in colorful packages, has cartoon figures. You gamify the vape device. You make it interesting. You can win prizes. In fact, people have taken to using marketing um, tactics to sell vape and e-cigarettes like they sell printers. The printer is cheap, right? If you buy a laser printer or inkjet printer for your computer, the printer itself is like 99 ringgit. But the cartridge, the ink costs a lot of money. And they are doing that now for vape and e-cigarettes, where the device they give for free. But the pot, the liquid, you have to pay. So it's like a very interesting way to get people to start vaping and e-cigarettes. But I can see here that the mushrooming of the vape outlets that are selling vape now and the economic implications on this. And I mentioned a few of the factors earlier. And I do hope that Prof. Syed could actually comment on some of this because of the way that the economy is intertwined itself makes it very hard to detach from later on. But you know what? We've done it before. And I give it the example of tobacco. Not long ago, the state of Kelantan was a huge manufacturer. There were huge plantations of tobacco.
Yeah.
Yeah. Today, you don't have those anymore. And it means that we can, go for alternative pieces of business or commodities and so forth. We don't need to hang on to vape as a way of gaining a livelihood. So, I think I'll stop there first, Dr. Nanida, and I'm hoping to hear from Prof. Syed. Thanks.
Okay. Now, thank you, Mr. Azrul. Now, let's bring the floor back to Prof. Dato. So, Prof. Dato, my question will be, how might the short and long-term economic burden of vaping compare to that traditional tobacco use or any conventional cigarettes that has been mentioned by Mr. Azrul just now, especially when considering future healthcare costs potentially linked to these vape-related illnesses?
Yeah. If you look at the scenario on the economic aspect of vape, in Malaysia, it doesn't happen in vacuum. Globally, if you look at the global sort of value of vape increase leaps and bounds. In 2013, it was 1.7 billion, but 10 years later, in 2023, 2024, it has gone to more than 40 billion US dollar. This is the big business at global level. That's why in Malaysia you see the market increase from 0.5 billion in 2012. It has gone to nearly 4 billion now. So it's a big business. And then if you look at the way that it has been portrayed and the way that it has been sort of defended by the defensive mechanism by the industry is to link it with the economic growth and also the economy of a special group of people who actually run this system or sell this product. So this is a very important aspect that we should remember. When we were doing the study on tobacco before, we know that the amount of tax that we can collect from tobacco that need to be sort of used for control of tobacco use is still very limited. And one of the biggest mistake that we did in our system is basically to remove the nicotine from the poison list. I think this is the worst case scenario that has been created for Malaysia, which actually, to a certain extent, bring about what happened to the prevalence of vape use in Malaysia at the moment. Without nicotine, there is nothing to attract people to do the vaping, because vape is the one, nicotine is the one that actually increased the addiction. Although the discussions regarding why it was removed from the poison list is that the government want to collect tax from the nicotine in the vape liquid. But until today, I think just a small amount of money has been collected from that. Not much returns from we get. I think from the economic perspective, we also know that for every $1 that we get from vape industry, we are spending $4 and $5 more to manage diseases related to vape, and also smoking as well. So 1 in 4 we are losing basically. But then we will still have not been able to take affirmative step to manage this situation, and things become more complicated as Mr. Azrul has said regarding the economy, which affects small and medium-sized industry in Malaysia, enterprise, and they are the one who actually move into this. I think there's not much we can do unless actually we revamp whatever regulation that we have done before, correct the mistakes that we have made, and then put this back in proper track. I think one of the things that we should do at the moment is to list back nicotine into the poison list, and then take it from there. So that by doing that, then vape, nicotine in vape will become a prescriptive item. So whether our political masters are actually willing to make this U-turn or not, that's another issue, especially when it involves different political parties that are holding the fort in Ministry of Health before. Are they willing to actually do that? I think if they make these major sort of changes, it will be positive impact on the whole system basically. I think we have enough of information at the moment to show that vape is harmful to health, harmful to public health. It doesn't bring any economic benefit, although there are a group of people who actually to push it for use of vape of harm reduction. But this narrative, it is just basically an excuse for them to delay the whole thing, to delay the implementation of the current laws, and not much data that are actually in support for that. What happened with that, it will lead to actually, whenever you introduce vape as a mechanism, it leads to dual use rather than stopping people from smoking or cigarettes smoking, the traditional cigarette. So, and also we know from harm reduction is that the mechanism for the harm reduction should actually do not do more harm than the action that we want to reduce. But here in the other way around, you are actually promoting something which do more harm than cigarette smoking itself, especially in terms of the delivery of the nicotine to the body system. I think from the economic perspective, we have really have to make sure that we do something. Otherwise, our system will suffer, especially with the current lack of resources for healthcare and all that. This is going to have a lot of more implication in our health system. I will stop there at the moment, Dr. Narida.
Okay, thank you, Prof. Dato. So with the figures that have been presented by Professor Dato just now, so I think it is definitely a worrying things to discuss about, considering the future healthcare costs that might be brought by vape-related illnesses. So now, Prof. Dato, just now we were talking about direct healthcare costs. While direct healthcare costs of vaping are often discussed, indirect costs like productivity loss, absenteeism, and rising of the insurance claims, which can also place a significant burden on these system as well. So in Malaysia's tax-funded healthcare model, do you think that these indirect costs being adequately considered in policy making? And how do you think that they may shape the future of our healthcare financing landscape?
First and foremost, I think we were talking about in direct costs is very difficult for us to quantify. Things like, for example, the cost of presentism, the cost of absenteeism and all that, we don't have much data on that. But other studies has been done before on cigarette, for example, which might shed some light. Nearly about 2/3 of the overall cost of chronic non-communicable diseases, especially cancers and all that, which relates to or due to smoking, are actually related to what we call the indirect costs, such as loss of productivity and all that. Nearly 2/3 of that. The direct cost is short. For example, when we talk about cancer, if it is lung cancer due to vape and also due to cigarette, for example, their lifespan is quite short. But then there are other things. The families has to suffer, the members of the family will not be able to have if the whole breadwinner, for example, they will lose everything. So this is where the indirect cost is quite important for us to consider. But definitely, vape will actually put into a different perspective because there are a lot of other diseases that has been identified related to vape. For example, conditions like heart failure, and then some psychological effect as a result of nicotine use, for example, for long term, and psychiatric conditions which are related to that. All this actually will put in more resources that are going to be lost through use of vape, and we have to put this in the proper perspective. And we must remember that currently we have increasing prevalence of mental health in our population as well. This is another perspective. Whether this is linked to vape or not, we need to study it in more detail. But certainly, these are the resources that are hidden, which cannot be clearly identified from our system. And in Malaysia, we are still dealing with the what we call the tax-based system. We don't have a health financing system, and government is actually paying for most of the resources, and this leads to a lot of problem because when somebody hit with a chronic non-communicable diseases, the resources is not adequate for the government to cover everything, and as a result, it will lead to high out-of-pocket expenditure. We already have high out-of-pocket expenditure in Malaysia at the moment, nearly about 38-39% of the total health expenditure, and this is going to go higher if we don't control vape in the future.
Okay, thank you, Prof. Dato. I think with that question, we can now move into our final segment, which is round 3, which is policy, regulations, and industry influence. So the first question for this round 3 is meant for Mr. Azrul. I quoted, the Ontario Tobacco Research Unit highlighted that enforcing access regulation, especially for youngsters, is critical in reducing illegal sales and access to tobacco and e-cigarettes. So Mr. Azrul, in your view, what do you think are the additional strategies should Malaysia consider in order to strengthen the enforcement and curb the access to vaping products, especially in terms of both commercial and social supply?
Well, Dr. Nuanida, one of the key aspects of that really goes back to the treatment of vape and e-cigarettes, especially those that contain nicotine, to be treated similarly to that of tobacco products. And that's already happened, which is very fortunate because that recommendation was taken up by the legislation that we are now currently in force. That's a very important point because it means that we're not starting from zero. We already have the experiences of enforcement using the lessons learned from tobacco. The issue here really is to address some of the problems concerning loopholes and enforcement issues, which was mentioned earlier, but also the concerns relating to black market access to these products. Because the issue here is, even though it might be considered legal, it doesn't stop from there being a black market anyway, especially if the regime is quite strict. And so there will be inevitably, just like we have for cigarettes, a black market that will escape the possibility of it being able to be taxed, for there to be revenue drawn from it, and most importantly, some of those harmful aspects of vape, such as adulterated vape liquids using illegal drugs, which is happening right now. We are already starting to see that the fentanyl is coming in to Malaysia, and one of the ways it's coming into Malaysia is through the adulterated nicotine liquids of vape. And as mentioned just now at the beginning, you have open and closed, right? You have open and closed systems. With closed systems, at least you have a chance to regulate and enforce whatever is in that. So if you have a factory here in Malaysia, in Selangor, for example, you can go to the factory, you can check. Syrium will check and make sure that it complies with existing legislation. The problem is, what do you do about the open systems? And this is where a lot of the stuff happens. And not to say that you cannot tamper with closed systems as well. You can, but with open, it's really bancho. Made to order, literally, and that's where a lot of the experiences that we're starting to see from other countries such as Indonesia, where they're suffering from cases where people who are using those adulterated vape products end up falling very, very ill and even causing death and disability. So how do you address that issue of enforcement? And we are looking at needing to see pragmatic solutions, but also approaches to prioritize what needs to be done. Is it just about sales? Is it about access? Is it about the existence of the product altogether? And there's an ongoing conversation right now in terms of banning vape altogether. There's a little bit of a panic situation that's happening, but you can see that some states are already starting to think about, instead of dealing with the ban on vape and e-cigarettes at the federal level, states are taking the interesting approach of banning any kind of license dealing with the sale of vape. So you don't ban the use and sale of vape itself, you ban the issuing of licenses to businesses that are going to sell this thing. So, they seem to have given up on the federal strategy, but decided to take on their own approach. So you can see some of the East Coast states have already taken that step. I think Terengganu, Kelantan, there's some, I think the North states as well, Kedah,
Ya, Kedah.
Kedah, Perlis, I think, has
Perlis,
as
yeah.
well. And I
In
just
August,
saw
if I'm not mistaken.
an
Yes.
Yeah, Perlis, 2 days ago.
just a moment ago that Selangor is already taking a very interesting step of, banning vape advertisements in compliance with the existing legislation. But also there's conversations in Penang, looking at taking that same approach that the other states. So these are some of the strategies that are being taken on to address the issue of the challenges of regulations. But here and there is a problem here, Dr. Nanida, because you have industry influence that are coming up. Just as we saw them involved when we were putting together the legislation a couple of years ago, where we saw very much that despite the fact that it is prohibited under the World Health Organization's FCTC, which is governing the behavior of policymakers, industry concerning engagement with industry, we saw that in the development of the Control of Smoking Products for Public Health Act, Act 852, there was a lot of attempts by the industry to influence what was going to come up. And we now see the industry yet again trying to influence the enforcement of this legislation. So they're saying things like, what's going to happen because you're going to threaten livelihoods, the economy is going to suffer, we're going to have black market, there's not enough time to adopt these measures. So there's a lot of that, right? So the problem here is how then do you ensure that specific populations like young people, adolescents, children are able to be protected, from being brought in to vape and use e-cigarettes. To be honest, at this point of time, because of what happened a couple of years ago, due to the deregulation of nicotine vape, we have a huge gap to overcome because it's everywhere, and a lot of young people, adolescents, children are currently vaping and smoking e-cigarettes. And what do we do about that? How do we help them? I don't know. Unfortunately, is the answer to that, because we are working from behind, And the issue here is that perhaps there's something to be learned from the strategies of dealing with the tobacco when it was in the 60s and 70s, when they were targeting children and young people with cigarettes, to learn from that experience and see what we can do. Because one of the things we need to ban is things like these flavors that are popping up, like bubble gum, air bandung, teh tarik, raspberry, all these fruity flavor, which is very interesting, bubblegum pop flavors and so forth. It makes it interesting not just for adults, but actually for children as well. Even the devices themselves need to be regulated and banned from being produced into shapes that are interesting for kids, like Mickey Mouse or the different types of children-orientated shapes, like that are shaped on cartoons and so forth. Things like gamifying these devices as well needs to be restricted and banned because they are targeting children. So the issue here is what we do about ensuring that the industry complies. And we're a rule of law nation, so I'm hoping that when legislation comes out, is passed, the industries will follow. But the fact of the matter is that unless there is strict enforcement, very often there is a bending of the rules which will occur. Because, as I mentioned just now at the very beginning, this is a big industry. There's a lot of people employed. There's a lot at stake, and the example really, I have to say, all we need to do is the failure of us to enforce the display ban at the moment gives you a flavor of the weaknesses or the lack of ability to enforce laws and regulations that have already been passed. And industry is not going to stay quiet. They're going to push back. They're going to work through policymakers. They're going to work through politicians to try to influence them to push back. So the good news is, I hope Prof. Syed will agree with me on this, is that what we're seeing in the other states coming up with this innovative approach is a way forward, but it also involves politicians. So maybe they've woken up to the realization that all this assumption that we've made previously about there being a strong opposition to banning vape and cigarettes is mistaken, is wrong. Actually, the public want to see a restriction, or even perhaps a ban, of this device to protect children and young people. Maybe there's a conversation to be had about reintroducing the generational endgame that was abandoned previously, and seeing if we can put that into effect, because other countries have done it. It's illegal to vape in places like Singapore, for example. So why can they do it and we can't? So there's a lot to be discussed there, but what we need to really bear in mind is the influence and the positioning of the industry in some of these conversations.
Okay, Mr. Azrul, it takes a whole village to rectify this issue.
Yeah.
So, could you name a few of the specific agencies or any organizations that you have in mind that potentially collaborate in order to improve this regulatory effectiveness?
Well, the thing is that first you have to look at the punco kuasa, the source of authority to enforce legislation and regulations. And at the moment, that is squarely within the purview of the Ministry of Health. However, the approaches that have been taken by the other states are not through the Ministry of Health. Very important. They're using their own powers under the state laws for the granting of business licenses to restrict and control the sale of vape, which is another ministry. It's another bidang kuasa. It's also another jurisdiction. It's actually at the state level. So we can already see that even though the ministry at the federal level, it's sort of restricted in what they can do, but at the state level, they're figuring it out by themselves. Interestingly, without necessary direction from the state, from the federal government, on what they can do within the purview of their powers. So you're asking who should be involved. Well, I can say that uh, at the federal level, the Ministry of Women, Family, Community Development, the Ministry of Youth and Sports, definitely. Ministry of Health, of course. Ministry of local housing and, sorry, housing and local government. Some of those ministries there help with the overall environment, and this is something that we can do. But I'm going to take inspiration from the states working it out on their own, where maybe we need to look beyond the federal government, look and see what we can do with the states, because it's their communities, it's their families, their people who are increasingly using vape, who are falling victim to vape related diseases and illnesses, and so they could be very well owning this problem in a way that the police. I'm sure you've seen some of the comments by the police over the past several months. They're very worried themselves about the increasing number of vape that's been adulterated with illegal illicit substances, and they're calling for a ban. But the power here is really linked back to political will. If there's political will to do this, if there's support from the public, then it could happen. But again, the industry influence is very strong because, as I mentioned to you just now, it's about jobs, it's about revenue to the economy, it's about being a major exporter, which means that it's good for Malaysia, etc., etc. So there's a lot of factors here that we have to actually consider when we are having these conversations, but most importantly, when we are suggesting what we're going to do about it. And this is something that I feel that we need you said a whole village. Sometimes you don't need the whole village, lah. You just need some of the people of the village to just speak the right words, say it out loud, and not be afraid, and get it done. If we're waiting for the perfect moment to get it, resolved, then we'll never get anything done, really. So in this case, I think the states are giving us an example of what they can do within their own purview, and we should think about doing something similar in the other states as well. Peer pressure works. So all the other states are looking, oh my God, these guys are already doing this. What about us? Johor did it years ago. I think back in 2016, 2017, they introduced that ban on businesses that sell vape, but nobody else followed them until recently. So it's an interesting development that we need to look at, but it will help if everybody is on the same page. But that's not going to happen, lah. But we can try to get and do that.
Okay, it's a valid point, Mr. Azrul. Perhaps we could have Professor Dato to elaborate further. So, Prof. Dato, with states like Kelantan, Terengganu and Perlis has taken steps to restrict vaping, what can Malaysia actually learn from their approaches? And do you think it is possible that these state-level actions be expanded into more comprehensive strategy in order to regulate or even banning vaping nationwide?
Yeah, I think what happened in the last few weeks when we see that the states are taking this action, because there were a lot of reports in social media regarding the impact of vape. There are people who died from vapes, and at the same time, there was a report on the use of vape by school children. I think to me, this is a good step. We put some pressure on the central government because the central government are so difficult to move because of their mistake that they have made before and also some other issues. But at least I believe that if the states are actually taking this action and the other states, which are neighboring states, are also taking action, then it will be more effective. For example, even if we actually ban the opening of shops in Kelantan, for example, or in Terengganu, people can still get vape from Pahang, which is so near, for example. So I think the government should look into this and follow suit. Although you know that the state that are doing this maybe for political reason rather than practical reason, they want to show that they're doing something to their state. But at least the central government should actually wake up and follow suit, because this is good for the population. I think big state and richer states, like for example Penang, Selangor, for example, should follow through. The reason why Johor did it is because of a strong political, strong support from the Sultan. He himself actually made a statement regarding this issues of vape, and it was a decree from the royals, from the royal family. I think this is very important for us to consider this. I believe that this is the steps that can be taken. Although we cannot ban it totally, but if you make it difficult for us to actually distribute and also sell vape, that will be one of the mechanism that we can look forward to do this. I think, of course, given the current situation, maybe it's quite impossible for us to totally ban vape because of this regulation. I'm worried about if you want to revisit DEG, because I was told that there was some indication that some people might wants to revisit GEG. The issue is that are they doing it, or they want to do it honestly, or it just because if they want to repeal some of this regulation, it might delay for some other changes that are required by the government to actually totally ban vape in the future. So it might be a tactics by the industries that we have to be careful about this. It's better than rather revisit the GEG is actually to look at where the loopholes of the current regulation, do not delay anymore for the full implementation of the current laws that has been looked at. And then one thing that they can do easily is basically to put back nicotine into the poison list. I think that need not go to the parliament. You need not change any law or any regulation, because this is just by the virtue of the Minister of Health as the given the directive, because that changing the list of the poison item in the poison list is actually by Minister of Health. I think that can be done much easier than repealing some of the laws that we have lost in terms of the battle to control the use of tobacco and also vape before. I think Malaysia is being looked by many other countries, especially when we heard yesterday that our minister and also two other advocates for control of vape and tobacco has been awarded by WHO. I think I hope that they come back and have some fresh idea, and then try to control the use of vape in our country. Things are urgently, and this need to be action need to be done and seen to be done by the population. Otherwise, I think we will be in big trouble in the next few years ahead. I think that's all from me, Dr. Norila.
Thank you, Prof. Dato, for such insightful response. I think we have a very limited time left. Maybe we can open the floor for Q&A session right now. Maybe we could take a few questions from the audience.
Dekat mana they type on the chat, is it?
Yes, it's going to appear on your screen. So the first question, hello, Prof. Dato. Do you believe dropping the GEG was a missed opportunity to reduce long-term national healthcare costs, especially with the growing use of e-cigarettes among adolescents? So how do you see it, Prof?
You believe dropping GEG was a missed opportunity to reduce long-term healthcare costs? Oh yes, certainly. But I think GEG was actually one of the things that we have planned. Is a very unique and also ideal situation, but I think it was the plan was not properly organized in that sense, and there were a lot of issues which relates to the political intervention, and also there was a report that we missed the GEG issue because of the strong lobby from the industry. I think when you have political parties that are actually willing to listen more to the industry rather than to look at the population, I think this is what happened. Certainly, yes, I think this is the thing that we have missed, but I think it is not the end of everything. We should be able to use existing laws that we have in order to control vape. Azrul, you cannot hear me, is it? Dr. Nurainda, can you hear me?
Yes, yes, definitely. Okay, okay, next, maybe we can have another few questions. Okay, next question. How effective is vaping product taxation as a source of government revenue, and how does it compare to tobacco tax revenues? I think let's bring Mr. Azrul for this one.
Thanks. Well, this is a uh, it's a new taxation, so the collection is quite new as well. As of last year, I think the amount of money that was collected for vape was around 400 million over the past couple of years. When you compare this against the taxes that are collected for um, tobacco, in 2019, the amount of tobacco-related tax that was collected was 3.9 billion. So it's a huge gulf, in terms of taxation for tobacco versus for vape. But again, this was based on the rate that was initially provided, and now what we are actually calling for is actually an increase in the um, excise duties that are being imposed upon. So even with the taxes for cigarettes and tobacco, we are seeing that it's not changed actually since 2015. So it's 10 years ago was the last time that the tax rates for tobacco were changed, and we argue that there should be a change for that uh, as well. So we're arguing for an increase to 77 ringgit per stick of cigarettes, which is equivalent to 61% excise tax duties for retail. So this would actually bring in an additional revenue to that, 4 billion I mentioned just now, to an additional 770 million in terms of revenue. So at the moment, cigarettes, tobacco still collect the lion's share of tax revenue. Vape is still very much in the windscreen, but the problem here is really whether or not it's efficient in collecting that tax, and that's the problem with regards to vape. Like if you have closed systems and you're taxing the closed systems, that's easy to do. What about those open systems? How do you tax those? And when you look at the landscape, you find that 70% of the landscape, again based on the industry data, is really open systems. The other 30% is the closed. So we are seeing possibly a large part of the vape landscape not being taxed properly in the way they should. But again, there's been a lot of conversations about how much money we can collect from the vaping industry, and there were some wild claims of around 3 billion, which is impossible, seeing how the value of the industry itself is around, 4 billion. So it's still early days, really, with regards to how much tax can be collected. But one would argue is some tax is better than no tax. So that is the philosophy that we're going with. But if we are using taxation as a form of prevention or control of vape, at the moment, unfortunately, I have to say that it's not effective. The vape tax can barely be felt on any of the disposables or the vape devices, and so at the moment, I think we still need a few more years of experience to see how we can better improve on this. But I can say to you right now that if you can afford to buy a vape disposable at 15 ringgit and it has around 8,000 puffs, 5% nicotine, I can tell you it starts looking very cost effective compared to a pack of cigarettes, because it's actually, when you look in terms of the economy of a disposable nicotine vape, and you get more puffs out of it as compared to a packet of cigarettes, I can tell you a lot of people are going to go migrate to nicotine vape, but it doesn't address the problem of nicotine addiction. And this is where the problem lies, which is just a transfer from one nicotine delivery device to another, and the problem still exists. In fact, I would argue it exacerbates the problem even further, because if in the past You didn't have as many people who are addicted to nicotine because it was solely through tobacco products, cigarettes, cigars, and so forth. Now, with vape being such an easy entry into using nicotine, you are going to have more people who are going to be having an addiction problem with nicotine and a much more wider base, meaning they're going to be younger and they're being more female, and it's going to be a larger group of people. So we are seeing vape in the future going to be a much larger problem compared to cigarettes as it is right now.
Thank you, Mr. Azrul. Maybe we could take another one question from the floor. Okay, I think this might be the final question. Is it possible to implement policy that restrict hiring of smokers and vapers in health sectors or place discipline measure, just like certain job requirements require physical conditions like height and fitness? So what do you think? Maybe we can get Professor Dato to answer this one.
Yeah. This is the interesting idea, but I think we have discussed about this when we talk about the smokers. Yeah, but issue of human rights and all that come to the picture and make it very difficult to implement. I think what MOH and also not only in Malaysia and many other countries, if you have their staff who are smokers or vapers, then they tend to provide support in order for them to just stop smoking and also stop the activity. The same thing like issues of controlling obesity among the staff and all that thing. I think it's quite impossible for us to implement this because of this issue. But I think other mechanism to actually control this activity or bad practices and bad behaviors among the staff should be carried out rather than putting a sort of limits for them not to be able to join this service. We know there are even doctors who actually become vapers and smokers, and this need to be sorted out in a different way rather than the affirmative action that was actually suggested. I think we had to be a bit more innovative in order to address this issue. That's what I feel, Dr. Norida.
Okay. So I quite agree. Instead of punishment, maybe we need to come up with more positive approach to come up with this solution. So I think with that question, we have come to the end of the discussion today. As we conclude today's session, we have explored the complex impacts of vaping on public health, the economy, as well as youth behavior. Both of our panelists also discussed about the necessity of clear regulations and also the enforcement efforts. So I think this discussion has highlighted both the opportunities and also the challenges in developing effective balanced policies moving forward. So thank you very much, Professor Emeritus Dato Dr. Syed Mohamed Aljunid and Mr. Azrul Mohd Khalid for the enlightening and insightful discussion today. I believe all of us have gained new perspectives and deeper understanding on these important issues. So to all participants, we hope that the knowledge shared today will inspire meaningful action in your respective roles, whether as professionals, educators, or members of the public. We also encourage you to stay tuned as we now hand the session back to our MC for the Kahoot quiz, where exciting prizes await our top scorers. Once again, thank you for joining us today. Over to you, Miss MC of the day, Dr. Nur Ain. Thank you, Prof. Dato. Thank you, Mr. Azrul. See you soon.
Thank you.
Thank you, Dr. Nuradida Hani, and a big thank you to our panelists for the engaging and informative discussion. Now, it's time to lighten things up and test your knowledge. Let's move on to our Kahoot quiz, which will be based on the webinar session you just attended. The top 3 fastest participants with the highest scores will each receive a special prize. So get ready and may the fastest ones win. Before we begin, just a quick reminder to take a screenshot of your Kahoot registration or participation screen. This will serve as a proof in case you are one of the winners and need to claim your prize later on. Without further ado, let the Kahoot begin. Congratulations to our top 3 winners. To claim your prize, kindly contact the organizing team via email at smileuitm.webinar@uitm.edu.my and please provide proof of participation and name used. That concludes our session for today. Thank you once again for being part of the Smile 4.0 webinar series, and we look forward to seeing you in the next session. Be sure to join us again tomorrow for our next webinar session titled Pendekatan Menangani Isu Ketagihan Vape dan Rokok Elektronik di Kalangan Remaja, which will be going live at 9 a.m. in the morning. We look forward to having you with us. Stay safe and take care. Assalamualaikum and goodbye.
Magic mushroom merupakan sejenis bahan psikoaktif baru atau NPS yang memberi kesan halusinasi yang cukup tinggi kepada pengguna selain tergolong dalam jenis dadah 3M iaitu bersama Molly dan McDonald. Berbeza dengan jenis dadah yang lain, akses terhadap magic mushroom cukup luas dengan ia boleh didapati menerusi rokok elektronik yang dijual secara terbuka di pasaran. Menurut Ketua Penolong Pengarah Pemulihan dalam Komuniti, Bahagian Rawatan, Perubatan dan Pemulihan Agensi Anti Dadah Kebangsaan AADK, dadah jenis ini banyak digunakan dalam rokok elektronik.
Dia adalah daripada kumpulan dadah halusinogen. Di mana kesan dia boleh langsung macam memisahkan dunia realiti dengan dunia khayalan. So maksudnya once dia ambil magic mushroom ni, kenapa kita nak highlight perkara ni, because of dia sekarang banyak digunakan di dalam cecair-cecair vape.
Menurutnya, dadah jenis ini tidak dapat dikesan menerusi ujian air kencing, namun memberikan kesan luar jangka yang berpotensi menyebabkan kecederaan kepada pengguna dan orang sekeliling.
Ada seorang ibu tu call, saya ingat lagi, dia call, dia bagi tahu anak dia balik daripada sekolah, panjat dinding. Cuba menghantukkan kepala dia ke dinding. Kita tanya dia buat apa? Dia baru hisap vape je. So kita tak boleh check dalam dia punya urine.
Tambahnya, kesan dadah jenis magic mushroom adalah lebih parah berbanding dadah sedia ada, sehingga usaha yang sangat tinggi diperlukan bagi mencegah penularannya di negara ini.
Pada akibat isap vape, seorang pelajar lelaki tingkatan 4 dari Kemaman, Terengganu ditemui dalam keadaan tidak sedarkan diri di perkarangan sekolahnya dipercayai akibat menghisap vape jenis magic mushroom secara berlebihan pada Isnin lalu. Menurut sumber, pelajar lelaki itu terpaksa mendapatkan rawatan perubatan setelah mengalami kesan teruk akibat dari pengambilan bahan kimia itu. Pelajar itu kemudiannya telah dirujuk ke unit kecemasan Hospital Kemaman. Difahamkan mangsa telah mengalami sawan kritikal berpunca dari pengambilan perisa bahan kimia yang berbahaya itu secara berlebihan dan sehingga kini pelajar berkenaan dilaporkan masih dirawat dalam hospital.
Dulu 5 hari, sekarang dah sehari boleh dapat dah. Jangan buat ada orang, tak temu malu. Relax. Tu kalau macam
Ni vape ya?
Vape tu, dia bubuk flavor dalam flavor tu, nama dia mushroom. Nama cendawan elok, tapi kena ada dia ni.
Aku miskin apa?
Owner Isyak Masrum Isyak Masrum. Langgar kereta sebelah. Kereta dah tahu.
Students currently vapes in the US, and in the UK, 7% of kids aged 11 to 17 now vape. And that number has nearly doubled in the last 2 years, so currently more young people vape than smoke cigarettes. But with the news of vape deaths amongst young people, the insane chemical flavoring and lack of regulation amongst new vapes, could science now say that vaping is worse than cigarettes? To start, the nicotine in vapes hits your bloodstream and brain faster than cigarettes. This is because vapes consist of a coil that ranges from 110 degrees Celsius to 1,000 degrees Celsius, which creates thermal conditions for a carrier like propylene glycol, which is literally stage smoke. Yes, when you are vaping, you're inhaling like Taylor Swift stage smoke right into your lungs. Mixed with an active ingredient, most commonly nicotine, and chemical flavorings, the vape smoke hits your lungs in a way that studies show ushers nicotine faster into your bloodstream and brain than cigarettes. Another study found that the sheer way that people hit vapes so hard, bro, each puff gives you more nicotine in vapes than in cigarettes. And nicotine is an intense drug. I always say that the hardest drug I did this year at Pride was when I hit someone's vape at a rave and I was ripped. This is because when you vape, the nicotine enters your bloodstream through the lungs, where it quickly makes its way to your head and passes through the blood-brain barrier to go directly into your brain. Here, the nicotine causes a series of complex biochemical processes to increase dopamine, cause feelings of motivation, awareness, concentration, elevated mood, and other neurochemical processes that will relax your muscles. Nicotine's an interesting drug. It makes you feel mentally aware and alert while physically relaxing you. It's an amazing feeling that people get addicted to. As the nicotine rush ends, cravings begin, and most recent studies show that the cravings appear within 4 hours of your last nicotine hit. In theory, this whole process is more intense with vapes than cigarettes because vapes have more nicotine in them. Nicotine also alters blood flow in your body, making people with penises lose their penis girth. Yep, a bit of watermelon ice can shrink your dick. One study found that men who use e-cigarettes are more than twice as likely to experience erectile dysfunction compared to those who don't vape. 13,000 men aged 20 and older who had daily e-cigarette use were 2.2 times more likely to report having erectile dysfunction compared to men who had never vaped, regardless of other risk factors. Because ED is caused by nicotine and there's more nicotine in vaping than cigarettes, in theory, you will get more erectile dysfunction from vaping. Now, you also may have heard of the mysterious vaping deaths that as of February 2020 had 2,807 patients hospitalized with severe lung issues from vaping, some of who were under 18 years old, and 68 people ended up dying. What you may not have heard is that these deaths were actually from THC vapes, which are less regulated than nicotine vapes. Some of the THC vapes had a chemical called vitamin E acetate in them, which when inhaled ravaged people's lungs and alveoli, leaving leaving them with symptoms of coughing, wheezing, and chest pain. Doctors were shocked and scared at first, but the general consensus was that mistakenly there was vitamin E acetate ending up in THC vapes, which was killing people. It created a disease called e-cigarette or vaping use associated lung injury, aka E-Valley. Now the hope is that there obviously isn't vitamin E acetate in THC vapes anymore, but again, E-Valley, the disease, was never caused by nicotine vapes. But that doesn't mean there isn't other wild chemicals in these vapes because of the flavoring. The concept of vaping was designed to be tasteless and ugly as a mechanism to help people quit cigarettes. But capitalism came a-calling, and to expand the vaping market, companies started adding flavorings to make people want to consume vapes more. Cinnamaldehyde, the artificial flavoring that creates cinnamon flavor in food, is now added to vapes to give them a cinnamony taste. But cinnamaldehyde also has been found to make the cilia in your lungs stop working, making it harder for your lungs to get rid of debris and expel pathogens, leaving you more vulnerable to lung infection. 2,5-dimethylpyrazine is added to vapes to make them chocolatey, and isoamyl acetate is added to create a banana taste. These chemicals have been found to cause pro-inflammatory effects on the respiratory tract that lead to cancer. A recent study found vape smoke contains benzene and other volatile organic compounds which lead to chronic respiratory conditions. Also, the vaping coils have manganese and zinc in them, which you end up inhaling, and this causes airway epithelial injury and tissue hypoxia. Mice chronically exposed to vape aerosols developed lung changes consistent to chronic obstructive pulmonary disease, aka COPD, the disease that kills 100,000 Americans a year from smoking. But in the end, scientists and physicians agree that cigarettes are still worse than vapes. Cigarettes involve a combustion reaction with tobacco that causes you to inhale tar and other chemicals that ravage the lungs in unbelievable ways. One lung researcher compared smoking cigarettes to putting your mouth over a car exhaust pipe and inhaling. Also, you may not know this, but 1.3 billion people in the world currently smoke cigarettes. 1 in 8 people is a smoker. This is why cigarettes are killing millions of people a year. Cigarettes are a worldwide trend, whereas right now vaping is mostly relegated to Europe, the US, and
Hai semua, saya Dr. Hidayah, host anda untuk Smile 4.0. Kali ini kami membawakan 4 sesi Marina dan 1 sesi podcast bermula dari 19 Mei hingga ke 22 Mei. Mari sama-sama kita mengupas dengan lebih mendalam isu vape daripada pelbagai sudut. Jom kita dapatkan informasi lebih lanjut.
Assalamualaikum dan salam sejahtera. Vape memang nampak cool, tapi tahukah anda terdapat bahaya yang tersembunyi di dalam vape yang dapat memudaratkan kesihatan? Ayo, sertai saya, Dr. Adib, di siri webinar Smile 4.0 bertajuk Mengatasi Ketagihan Vape, Bahaya Tersembunyi. Langkah berhenti dan kekal bebas vape pada 19 Mei 2025 jam 9 pagi. Bersama pakar dari universiti tanah air, kita mengupas dengan lebih mendalam isu ini.
Pernahkah anda terfikir apakah implikasi industri vape ke atas sistem kesihatan negara kita? Temui saya Dr. Nurani Dahani bersama pakar-pakar khas yang telah dijemput bagi membincangkan isu-isu ini melalui siri webinar Smile 4.0 dengan tajuk From E-Cigarettes to Healthcare, Exploring the Financial Implication of Vaping Industry pada tarikh 20 Mei 2025 jam 2.30 petang. Ayuh, jangan lepaskan peluang keemasan ini.
Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Jom sertai saya Dr. Nurin dalam sesi webinar Smile 4.0 yang bertajuk Pendekatan Menangani Isu Ketagihan Vape pada 21 Mei 9 pagi. Dalam sesi webinar ini kita akan membincangkan bagaimana sistem sokongan dapat membantu remaja yang terjebak dengan vape, peranan guru dan peranan tugas kesihatan. Jadi jangan lupa sertai kami ya.
Assalamualaikum dan salam sejahtera. Saya Dr. Julia ingin menjemput anda semua ke webinar Smile 4.0 yang bertajuk Vape and E-Cigarette Under the New Law pada 22 Mei 2025. Di dalam sesi webinar ini, kita akan memberikan penerangan jelas mengenai Akta Kawalan Produk Merokok demi Kesihatan Awam iaitu Akta 852 yang telah dikuatkuasakan pada 1 Oktober 2024 yang lalu. Selain itu, kita juga akan mendapatkan pandangan pakar-pakar mengenai pelaksanaan akta ini di negara ini. Ayo sama-sama kita fahami dan sebarkan maklumat ini.
Hello, hi. Betul ke vape lebih selamat dari rokok konvensional? Adakah ini mitos atau fakta? Anda semua mesti nak tahu kan? Jom sertai saya, Dr. Nur Ain dengan tetamu jemputan khas di seksi podcast yang bertajuk Vape vs Rokok, Mitos dan Fakta Meneroka Trend pada 21 Mei 2025 jam 8.30 malam. See you there!
Jangan lupa sertai sesi webinar Smile 4.0 yang bermula daripada 19 Mei hingga 22 Mei. Maklumat lebih lanjut boleh didapati di www.smileytm.com. Jangan lupa juga follow kami di social media Facebook, Instagram dan juga TikTok. Akhir kata, keep the habit, drop the vape and live more. Jumpa anda di sana.